Hello, my name is Brittany DeBoard, and my practicum was spent with the Virginia Department of Health, learning about the variety of public health services they offer while focusing on creating a Lyme disease prevention campaign. Next slide. The Virginia Department of Health is a state agency responsible for the overall health of Virginia residents. Specifically, the Mount Rogers District includes 8 counties and serves approximately 2,782 square miles. The Wytheville Health Department offers a variety of services to the community to include family planning, disease prevention, emergency preparedness, environmental health services, epidemiology, maternal and children's health, nursing home screenings, and population health, just to name a few. Personally, I spent time working in the WIC program, the Harm Reduction Clinic, and took part in COVID testing and COVID outreach by passing out supply bags with the local police department. I was also involved with case investigation, contact tracing, and creating a Lyme disease prevention campaign. Next slide. My focus during my practicum was that of Lyme disease and working to implement a prevention campaign that would be used throughout the area. Lyme disease is a preventable disease, but left undiagnosed or untreated can lead to chronic negative effects experienced by the individual. Contraction of this disease occurs when an individual is bitten by a tick infected with Borrelia burgdorferi, a type of bacteria. Common vectors of this disease are the black-legged deer ticks that are responsible for the transmission of this disease. Once contraction of this disease has occurred, an individual can experience symptoms affecting several organs to include skin, musculoskeletal, neurological, cardiovascular, ocular, respiratory, renal, and hematoid organ systems. Additionally, specific symptoms associated with this disease include erythema migrans, arthritis, facial palsy, and meningitis. For patients with pre-existing condition, the contraction of this disease can exacerbate existing conditions, furthering the importance of early detection and prompt treatment. Over the years, Lyme disease has quickly become prevalent in the southwest region of Virginia, more specifically the Mount Rogers District, becoming the #1 reportable communicable disease outside of chronic hepatitis. Data show that a reported 68.8 cases per 100,000 population were prevalent in this region of the state. Additionally, the geographic location of the area includes a large portion of the Appalachian Trail, multiple parks, and wooded areas that provide a haven for ticks to live and thrive, making this area a hotspot for ticks carrying Lyme disease. As a result, from the provided data, in addition to the geographic composition of this area, the target population focused on all individuals of this area who frequent the outdoors, whether that is in the form of outdoor recreation activity or through exposure to a yard with tall grass or brush piles, as those are also ideal places for ticks. Methods related to prevention and public health matters such as Lyme disease, including education, use of best practice, and reaching the target population. The Virginia Department of Health is an innovative organization that emphasizes each of these areas to efficiently impact the health of Virginia residents. Countless hours and resources are used each year to ensure all these concepts are applied at each health department throughout the state. Information related to Lyme disease that has provided the foundation for the prevention program was gathered from an array of reliable sources to include peer-reviewed articles, an interview with state entomologist David Gaines, as well as knowledge gathered through the observation of multiple health departments and their practices. As a result of COVID-19 restrictions, the use of a survey was determined as the safest and most reliable method. To understand the general education level of residents within the Mount Rogers District related to Lyme disease, a survey was created using Microsoft Forms, and then the link was distributed through Facebook. While this method is not ideal, it did provide a true representation of the community to include individuals of all demographics. Next slide. Education in any prevention program is essential to impacting the target audience. Participating in meetings is a great way to stay involved in the local community and stay up to date with relevant information. This also includes one-on-one meetings with elite healthcare professionals to detail their their areas of expertise and provide a background of knowledge from their unique perspective and experiences. Discussions with Dr. Shelton highlighted the severity of this disease as she discussed this disease as being the #1 reported communicable disease for this district, and the lack of knowledge surrounding Lyme disease for the residents of this area was enlightening. Further knowledge was gained from interviewing the state entomologist David Gaines. He provided insight into common misconceptions related to Lyme disease, to include where common contraction occurs and the vector of this disease. It is commonly believed that only people who live out in rural communities where the deer population is plentiful will contract this disease. Dr. Gaines explained the epidemiology of Lyme disease for Southwest Virginia has dramatically changed within the past 10 years. Most ticks that are found in this area with the disease are heavily populated in suburban forest areas instead of rural areas. This is of great concern due to the fact that this is where the vast majority of individuals reside, work, and play, leaving them susceptible to infection. The second misconception is that deers are thought to be the main vector for this disease. As Dr. Gaines presented his research, it was clear that due to the development stage of a tick, that feeding most likely occurs in the nymph phase stage, and that most likely occurs on the white-footed mouse, which are plentiful in suburban forest. Proper education addressing these common misconceptions would greatly improve prevention methods taken by the residents of this area. Next slide. The total number of participants included 65 respondents. The survey was comprised of questions related to Lyme education, behaviors, and attitudes towards prevention. Education was the main method related to the establishment of a Lyme disease prevention campaign. Further understanding of what participants knew to be true and comparing those answers against peer-reviewed evidence and professional research was the key to understanding where to start with the educational process. Components that greatly impacted the educational process also included taking into consideration participants' behaviors and attitudes related towards Lyme disease. There were two common misconceptions, to include most transmission takes place around suburban forest and that infected ticks thrive in dense leaf piles. Both concepts were missed on the survey, as 52% of participants reported leaf piles as not being a place that ticks would thrive, and only one participant responded that suburban areas are the main transmission location. Results from the survey provided insight into the relatively low Lyme disease knowledge that is present in the residents of this community. All questions except for number 1 did not exceed a rate of 40% of correct responses. This identified substantial education should take place within the community. To create the biggest impact for the target audience, the campaign needed to be simple and easy to remember. Methods that were low cost and low maintenance would have the most impact for our target audience, so that was the major focus when creating Protect and Inspect. For the prevention campaign, extensive research was compiled to gather the most up-to-date and accurate information related to Lyme disease, specifically the signs and symptoms. The most common sign that an individual has been bitten by an infected tick is that of the erythema migrans, as mentioned before, and can take a few weeks to develop. As also mentioned, other common symptoms include joint pains, fever, chill, and fatigue. Other important information included how to remove a tick when someone needs to see a doctor. Protect and Inspect became the theme of the prevention campaign, created to educate individuals on the signs and symptoms of Lyme disease. Prevention focused on protective clothing, using repellents, and sticking to maintained trails. Special attention to the type of repellent was crucial, as one study supported the effectiveness of different repellents for different uses. The next component was that of Inspect. Based on the information gathered, the most effective prevention methods included tick checks, bathing promptly, and prompt removal of ticks to reduce the risk of exposure. These strategies were included in the Inspect section of the campaign as easy to remember practices while also being effective practices. As you can see in the slide, there is a portion of the prevention campaign that includes both the inspect and protect components of the prevention.